I've done that in agility dogs. So take it away.
Hi, like Dr. Biggs said, my name is Adeline Woodard, and today I will be talking about iliopsoas injuries in agility dogs. I was advised by Dr. Sip, and this is a photo of my agility dog, Cisco. Briefly about me, dog training and dog agility has been a huge part of my life ever since I can remember. I've been doing agility for 14 years and have had the pleasure of having 2 agility dogs. And the top left is my first agility dog, an Australian Shepherd named Susanna. And then here is my second agility dog. He was a long-haired Dachshund mix. In the center, I have a photo of all the women who made me who I am today. I lovingly call them my agility grandmothers. Aside from agility, I have 3 salamanders. This is Myrtle right here. She likes to watch television with me. I have Colorado and then Bart. Aside from salamanders, I love ornithology. This is a Harris sparrow, and then I play the banjo. These are my learning objectives for today. I won't go over them just because they're kind of a lot, but they're here for future references. So, what is the iliopsoas? The iliopsoas is a muscle composed of 2 other muscles, the psoas major and the iliacus. The psoas major is considered the strongest flexor of the hip. It originates from the transverse processes of L2 and 3 in the vertebral bodies of L4 through 7. The iliacus is a short muscle arising from the ilium. And here you can see the psoas major as it joins with the iliacus to insert on the common site of the lesser trochanter. As a unit, the iliopsoas functions to flex the coxofemoral joint, adduct and externally rotate the femur, and stabilize the core. This here is another image of the iliopsoas where the psoas major is in yellow and then the iliacus is in green. So what is canine agility? Canine agility is a really fun and fast-paced sport where handlers and their dogs compete for the cleanest runs and the fastest times. On average, it takes about 1.5 years to 2 years to train an agility dog to the novice level, so you can appreciate the time commitment that it takes to run these dogs. This here is an example of an agility course map where handlers have a predetermined set time to walk the course and memorize the order before they run their dog. And then here I have a brief video of what I believe shows the athleticism that these dogs possess. So one thing you'll notice that these dogs do is that they are constantly running an extension. This is actually a training technique to get faster ground speed time. But however, with great extension comes difficulty deaccelerating and tight turning, and that's where we see a lot of our injuries happen. So why does the iliopsoas matter? It matters because it's the second most reported injury next to shoulder injuries in agility dogs. So when we talk about injuries, we're going to see them most commonly at the muscle tendon unit. This is because it's the most weak part of the muscle tendon junction. And injuries often occur during eccentric contraction or when the muscle bellies are actually lengthening during contraction. This is most notably seen during deacceleration. Secondly, injuries can be acute or chronic. Chronic injuries are going to be used due to micro tears or overuse, primary or secondary to an inciting cause. So what are some things we want to look for when we suspect an iliopsoas injury in our history? 2 main things that a handler might come to you for is a change in jump behavior and slow weave pulls. And this can be particularly frustrating because in the higher level, any refusal of these obstacles results in an automatic NQ, which is a non-qualifying score. And right now, each agility run is running around $27 a run. So it's kind of a big financial investment if you have issues here. So when we talk about jump behavior changes, what are some things that we might see? We might see dogs knocking bars. We might see a refusal to extend. We might see a flat-out refusal of a jump entirely. And we might see style changes. And when I talk about style changes, in this photo you can see this dog is completely extended and flat against that bar, and you can almost imagine how much that iliopsoas is working. So if I have a border collie that comes in that typically jumps like that, but is now jumping like this with its hind end kind of more tucked up, there's not that extension, he's higher up off the bar, that can be an indication of an iliopsoas involvement. And then because iliopsoas injuries aren't just an ailment of agility dogs, but also household pets, we want to look for things like falling splay-legged on a slippery surface, a known trauma, and jumping in and out of a car is a common place where an iliopsoas can be injured. So what are some things we want to look for in terms of risk factors? First off is going to be breed. Breed is going to be important because border collies are the predominant breed with associated iliopsoas injuries. This is even when it's taken into account their high prevalence. Next is going to be weave pull method, which I'll get into that a little bit more later. But then thirdly is going to be dirt or artificial turf. This is because these surfaces are allowing dogs to obtain higher ground speed, but they're also more slippery, so higher risk of falling. Next, of course, we have dog speed, how fast the dog is going. And then lastly, we have jump height differential. And this is how tall an agility dog must jump relative to its wither height. And so in AKC agility, it's not uncommon for a dog that's 14.5 inches to jump 16 inches. And while that might not seem like a lot, over the course of 22 obstacles over the course of a weekend, it compounds. When we talk about weave pull method, this is kind of controversial in the world of agility. How do you train your weave pull method is a great conversation starter. There's two main trains of thought. One of them is teaching a dog to run through a channel of weaves, slowly shaping the behavior into weaving when we move in these poles. The second is called a 2x2 method, where dogs are trained to find the center of 2 weave poles consecutively. And then I'll play a video of that. And so you can see here that dog is constantly searching the center of those 2 poles, but you can imagine how many repetitions are required to shape that behavior with a full set of 12 weave poles. So that's why 2x2 method is more prone to Iliopsoas injuries. So when we do our physical exam, we always want to make sure to do a complete physical exam, but we're going to want to focus on our orthopedic components. In terms of gait, we might see a shortened gait if it's a chronic injury, or an acute lameness if it's an acute injury. And this lameness can even mimic CCL tears, where the dog is not fully planting its foot on the ground, but kind of toe touching. Other tests we can do is hip extension and internal rotation of the femur. This will elicit pain. Next, we can do palpation of either the psoas major, the cranial ventral wing of the ilium, which is its origin, or the lesser trochanter, which is where the muscle inserts. It's really important, though, to know that when you palpate, you have to be very, very careful and very gentle. If you're going to get bit during an iliopsoas exam, it's going to be during palpation. Dogs can react quite violently if it hurts. Next, we can do some objective measurements like goniometry, where the average hip extension for a dog is 162 degrees, and we can also do musculoskeletal ultrasound. And these last two are really great because if we do decide to treat an iliopsoas injury, they kind of give us benchmarks to track our progress. So when we talk about musculoskeletal ultrasound, this is a great way to identify acute versus chronic injury. In our acute injuries, we're going to grade them on a scale of 1 through 3, and we're going to see enlargement of muscle fiber associated with swelling and inflammation, hypoechoic core lesions associated with edema and hemorrhage, and then we're also going to see fiber disruption. Meanwhile, our chronic injuries are going to be hyperechoic scar tissue with fibrosis. And then here is a good image where you can see that hypoechoic core lesion of that iliopsoas that's affected in the left, and the normal echogeneity texture in the right. So this is my Navli question. Charlie is a 5-year-old male Swedish Vallhund. He regularly competes in AKC agility at the master's level. During the last 3 years, Charlie has been intermittently refusing the weave poles. On physical exam, pain is elicited when Charlie's hips are extended and internally rotated. What are some differentials for iliopsoas strains in agility dogs? So actually it's all of the above, and then that's a photo of Charlie, the Swedish Vallhund. So this brings me to my next point. A 2023 study showed that 73.6% of all iliopsoas strains or injuries had concurrent pathology, and the top 3 were going to be your CCL tears, or lumbosacral disease, and hip dysplasia. So when we have a dog that comes in that you might be suspecting iliopsoas, it's important to tease out these differentials. For our CCL tears, we can always do a cranial drawer and a tibial thrust. For our LS disease, a tail hike and palpation of that LS junction rectally is really good. And for hip dysplasia, we can consider radiographs or musculoskeletal ultrasound. So one thing that's going to be really important with iliopsoas is going to be managing expectations. Because if you have a handler that comes in with their dog, these are the first 2 questions that are probably going to pop up in their mind. How long does it take to recover, and when can I return to sport? And this here is a good graph that I believe depicts the different types of tissue types and healing times. And it's important to notice that muscle can take anywhere from weeks to months. So this isn't going to be a quick fix, 1 to 2 weeks of NSAIDs and crate restriction, and then the dog gets back to normal. That's just not going to happen. But on the bright side, 94% do successfully return to competition. 56% within 3 months, 24% within 3 to 6 months, and 14% within greater than 6 months. But as always, it's important to note that 6% are retired due to iliopsoas injuries, so it's important to communicate that with the client as well. This is another video that shows that weave pull behavior But I think it's a good video because it illustrates the level of athleticism that the owners are expecting their dogs to come back to. That's why it's so important to communicate expectation. Here you can see just the sheer amount of bending and torque on that spine, and you can imagine how much iliopsoas is involved in that motion. So what do we want to talk about treatment? In a 2022 survey, 88% of injuries were addressed by a veterinarian, so that's a high percentage of owners seeking care, but only 62% were actually sought specialty care. That shows that the majority of cases, just slightly under, are going to be a GP thing. So if you know about iliopsoas injuries and how to treat them, you can gain valuable clients because agility people do talk a lot. Mainstays of treatment is going to be conservative medical management and rehabilitation. We're going to want to focus on activity restriction, pain management, physical rehabilitation, and then always using our alternative modalities. What do I mean about alternative modalities? These include photobiomodulation, shockwave therapy, platelet-rich plasma, and physical rehabilitation. And together, these are going to help promote that tissue repair, pain modulation, cellular proliferation, and a release of growth factors. When we talk about physical rehabilitation, we're going to want to get the dogs to do 3 to 4 repetitions of a set exercise, slowly working our way up to 10 repetitions. When do we know how to kind of increase the challenge level? When the dog is exhausted by the end, but then within 30 minutes is back to normal. That's kind of a good gauge of, hey, I can increase the intensity. We're going to want to do this 3 to 5 times a week. So again, really important in communicating to the client that this is just not a passive thing. We have to be active participants in the dog's recovery. And like I said, progressive when the current level of work is no longer difficult. So what an example treatment plan might look like. For the first 1 to 2 weeks, we're going to want to focus on activity restriction and pain management. This is going to look like short leash walks no longer than 5 minutes per session. We're going to want to involve our multimodal pain management. We're going to want to use methocarbamol. A lot of studies find that it might be helpful. It's kind of like a won't hurt, might help situation. And then NSAIDs has a question mark behind it because some studies have found that courses of NSAIDs over 10 weeks actually delays healing in muscle. Next, we have our 2 to 6 weeks is going to be minimizing pain, regaining flexibility, and promoting healing. This is going to look like passive stretching where we're helping those dogs to go through the range of motion. Cookie stretching, play bows, and belly rubs. These are all great exercises that kind of activate and stretch the iliopsoas. Next, for the 6 to 10 weeks, we're going to want to regain strength, starting with isometric exercises, working our way to concentric and eventually eccentric. Here, we're going to want to do square standing for our isocentric, sit to stand and short distance hill walking for our concentric, and figure of eights are great for eccentric. For our weeks 10 to 16, we're going to want to slowly return to low impact work. This can look like an underwater treadmill, light cantering in a controlled environment. And then for our week 16, we want to start slowly building re-endurance. And this is important where we're communicating with clients the significance of warm-up and cool-down routines, long-distance trotting, and uphill sprints. So in conclusion, the iliopsoas is composed of the psoas major and the iliacus muscle. It plays an important role in core strength and hip mobility. Concurrent pathology is common in the iliopsoas injuries, and treatment can be prolonged and often involves a multimodal approach. But on the bright side, remember 94% of canine athletes successfully return to sport following an iliopsoas injury. These are my references. Do you have any questions?